The main symptoms of osteoarthritis are pain and stiffness in your joints, which can make it difficult to move the affected joints and do certain activities. The symptoms may come and go in episodes, which can be related to your activity levels and even the weather. In more severe cases, the symptoms can be continuous. You should see your GP if you have persistent symptoms of osteoarthritis so they can confirm the diagnosis and prescribe any necessary treatment. Other symptoms you or your doctor may notice include joint tenderness, increased pain and stiffness when you have not moved your joints for a while, joints appearing slightly larger or more knobbly than usual, a grating or crackling sound or sensation in your joints, limited range of movement in your joints, weakness and muscle wasting, loss of muscle bulk. Osteoarthritis can affect any joint in the body, but the most common areas affected are the knees, hips, and small joints in the hands. Often you'll only experience symptoms in one joint or a few joints at any one time. Osteoarthritis of the knee. If you have osteoarthritis in your knees, both your knees will usually be affected over time, unless it occurred as the result of an injury or another condition affecting only one knee. Your knees may be most painful when you walk, particularly when walking up or down hills or stairs. Sometimes your knees may give way beneath you or make it difficult to straighten your legs. You may also hear a soft, grating sound when you move the affected joint. Osteoarthritis of the hip. Osteoarthritis in your hips often causes difficulty moving your hip joints. For example, you may find it difficult to put your shoes and socks on or to get in and out of a car. You'll also usually have pain in the groin or outside the hip. This is often worse when you move the hip joints, although it can also affect you when you're resting or sleeping. Osteoarthritis of the hand. Osteoarthritis often affects three main areas of your hand: the base of your thumb, the joints closest to your fingertips, the middle joints of your fingers. Your fingers may become stiff, painful, and swollen, and you may develop bumps on your finger joints. Over time, the pain may decrease and eventually disappear altogether, although the bumps and swelling can remain. Your fingers may bend sideways slightly at your affected joints, or you may develop painful cysts, fluid-filled lumps, on the backs of your fingers. In some cases, you may also develop a bump at the base of your thumb where it joins your wrist. This can be painful, and you may find it difficult to perform some manual tasks, such as writing, opening jars, or turning keys. There's no cure for osteoarthritis, but the condition does not necessarily get any worse over time. There are a number of treatments to help relieve the symptoms. The main treatments for the symptoms of osteoarthritis include lifestyle measures, such as maintaining a healthy weight and exercising regularly, medication, to relieve your pain, supportive therapies, to help make everyday activities easier. In a few cases, where other treatments have not been helpful, surgery to repair, strengthen, or replace damaged joints may also be considered. Lifestyle changes. Exercise. Exercise is one of the most important treatments for people with osteoarthritis, whatever your age or level of fitness. Your physical activity should include a combination of exercises to strengthen your muscles and exercises to improve your general fitness. If osteoarthritis causes you pain and stiffness, you may think exercise will make your symptoms worse. However, regular exercise that keeps you active, builds up muscle, and strengthens the joints usually helps to improve symptoms. Exercise is also good for losing weight, improving your posture, and relieving stress, all of which will ease symptoms. Your GP, or possibly a physiotherapist, will discuss the benefits you can expect from an exercise program and can give you an exercise plan to follow at home. It's important to follow this plan because there's a risk that doing too much exercise too quickly or doing the wrong sort of exercise may damage your joints. Find out more about exercise guidelines, including simple ways to exercise at home. Losing weight. Being overweight or obese often makes osteoarthritis worse, as it places extra strain on some of your joints. To find out if you are overweight or obese, use the healthy weight calculator. If you're overweight or obese, try to lose weight by doing more physical activity and eating a healthier diet. Discuss any new exercise plan with your GP or physiotherapist before you start. They can help you plan a suitable exercise program for you. Your GP and practice nurse can also advise about how to lose weight slowly and safely. Find out more about managing your weight. Pain relief medicines. Your doctor will talk to you about medicines to relieve pain from osteoarthritis. Sometimes a combination of therapies, such as painkillers, exercise, and assistive devices or surgery, may be needed to help control your pain. The type of painkiller a GP may recommend for you will depend on the severity of your pain and other conditions. The main medications used are below. Paracetamol. If you have pain caused by osteoarthritis, your GP might suggest you consider taking paracetamol for short-term pain relief.